Hello, I'm Alina. I'm a senior at Harvard University studying computer science and global health. And today we're going to be presenting Santa. And here's the rest of my team.
Hi, my name is Richael Saka. I'm a sophomore at Harvard. I'm studying computer science and education. Thank you guys so much for being here.
Hi everyone, I'm Fiona. I'm a student at Harvard as well, studying history of science and computer science. Super excited to be here.
Hi, my name is Sarah. I'm a senior at the college studying regenerative biology and global health policy, and super excited to present to you guys today.
Is it okay if I just put it here though? I think it's okay. Yeah, I think I got it. Oh, yeah, sure. How do I? Okay, like this. Okay. Is it going?
Okay, hi everyone, we'll get started. We present to you Team Santa today, and we have built an application and website to track, monitor, and learn about your personalized breast cancer risk specific to women in Mexico. This is an overview of our team. As you can see, some of us are here, but some of us are waiting for us back home in Boston. So they are dearly missed, and we want to acknowledge them. In terms of the gaps we have identified, there are 3 key areas. 1 is breast cancer mortality in Mexico, 2 being the lack of centralized surveillance systems, and 3 being the low awareness of environmental risk factors specific to breast cancer risk. And what we're focusing on in our application is this third point, which leads to our next slide. In addition to those gaps, we have also found there are barriers to accessible healthcare access, and this is specific to the diagnosis and treatment of breast cancer. We spoke to Indigenous nurses through our advisor, Dr. Francisco, and we were very grateful to learn that there are a lot of risk factors related to environmental pollutants specifically, but in addition to that, there are a lot of risks in even getting women to the proper establishment where they need to be treated, and also socioeconomic factors that play a large role. Next slide, please. And therefore, we present SANA, which I will pass on to Alina.
Thank you. So this is the system that we've built for addressing this problem. So basically, we've created a public health tool that tracks breast cancer risk while raising awareness of environmental risks. And we've done this through a 3-part system, which includes a mobile app, a website, and an algorithm. So first, we're going to talk a little bit about the mobile app that we built. So this is the Santa mobile app, and this is a public health tool that helps the public monitor their personalized breast cancer risk based on their geographic location, demographic, and lifestyle, raises awareness and educates the public on breast cancer risks, especially environmental pollutants. And it does this through a few key features, which we have a little demo of the app, which we'll go into now. So I can do this. Does it show it though? Oh, I need to exit this, right? Does it show it? Or no? Wait, how do I show the demo? Oh, do you think you can play it in the slideshow though?
Yeah, hold on. Let me see. Wait, no, yeah.
Oh, it's because.
Okay, let's see if we can play from here.
Yeah, I mean, can't we? You need to exit the show though.
Okay. And show.
And show, and then here.
Mm-hmm.
You can't. Wait, try to play it and see what happens. It's not playing.
Let me see.
Do you know how to screen share this video?
You can just move it over here to the left.
Oh, to the left?
I think it might be, I don't know if it's mirrored or not.
Oh,
okay.
Here, I'll do this.
Okay.
then
Okay.
now you can play it.
Okay, yeah.
Okay. Could you go back to
Yeah.
the beginning?
Okay.
Okay, so this is the demo of the app. So this is just it on like some smartphones. So there's two features that we implemented for this hackathon. So first, there's the environmental dashboard, which will help the user monitor their environmental risks. So right now, it's asking me for my geographic location, like asking me for permission. And here I say yes. And then it makes an API call to grab your real-time local air quality, water quality, and UV index for the day so that users can monitor like what is these environmental risk factors that are in my daily life. And then here's a cancer risk survey as well to create like this personalized risk assessment. For this, we didn't fully implement the survey and the algorithm because of the time constraints of the hackathon. So this is kind of just like a demo. And yeah, so that's the mobile app. Yeah, and then you can play it again, I think.
Yeah.
Sorry for the technical difficulties. And now, some features from Rochelle.
Yes, so outside of the MVP that we developed, I also developed a mock-up of what the final product would look like. So the app features include an environmental dashboard, the cancer risk assessment tool, and also educational content, which is in the form of a web series where we will be employing public figures that are influential in women's health and breast cancer in order to really have an educational component that people will be able to take home with them. And then we also have user notifications and alerts, so people will be able to assess in real time the breast cancer risk factors that are happening around them. So as on the slides, I developed a mock-up of what the final risk factor assessment survey would look like. So this survey would be deployed when every woman signs up for the app. They will have the option to take the survey. And then we also have the Hear from Experts tab, which depicts our web series and our educational component as well. And then we have the environmental dashboard, which shows like how the air quality, the water quality, and also the breast cancer risk hotspots in Mexico. And then also the notifications and alerts, which will be sent from our dashboard from public health officials. And then finally, another educational component which allows people using the app to actually understand the data that they're reading, because it's not only important to have the statistics presented, but also presented in a way that makes it easy for the general public to understand. So next we have the environmental factors dashboard. So this dashboard is a digital ecosystem that will be available to public health officials and officers in the area, so that they will be able to not only see the breast cancer hotspots in various areas, but also be able to use this data to see where, which places need the most help, and also direct resources to those areas as well. Okay, so I will be passing it along to Jasmine, who recorded a video to explain how this dashboard works.
Comparing different. My name is Jasmine. I will be demonstrating the web portion of the Sauna web app. The purpose of this website dashboard is to display the map comparing different cancer risk factors such as air quality, water quality, and UV index across different geographical regions. The website dashboard used React.js, CSS, and Leaflet. Leaflet was used to display the map, and CSS and React.js was used to create the dashboard. We decided to create a dynamic user interface which provides users information about different cancer risk across various regions, as shown here. We also integrated a machine learning model. This machine learning model selected various geographical features with suitable data to be merged and used to predict breast cancer mortality and breast cancer risk. The data points were scaled to have a mean of 0 and a standard deviation of 1, and we split the data into training and testing sets. A random forest regressor was then trained on the training data, and a composite risk score was created by combining all the geographical features. We then merged the geographical spatial data with the composite risk score, and we created this plot for visualization. Another important feature is the reporting feature, such as the report of risk factor. Users can click this button below, and they can send a notification. For those who have access to the website, can send a notification for any app users on any cancer risk factors, such as environmental or other restrictions and risks.
Okay, so yeah, that was the demo of the website and the algorithm, and then now, here.
I guess finally, to wrap up our presentation, we're hoping to have far reach in terms of reducing breast cancer incidence and also increasing awareness of breast cancer and the intersection between environmental factors. So in order to conduct an impact assessment, we wanted to prioritize on data collection in terms of breast cancer incidence into relation to environmental factors, looking in terms of app engagement, environmental factor engagement, looking at questionnaires, and also in-person qualitative surveys. And in the future, we're hoping to engage this in terms of an IoT sensor, so looking at low-cost hardware. For example, we have a schematic here of how to integrate an app feature with looking at water sensors and looking at pollutants such as metallurgic factors and relaying that to the environmental dashboard. Secondly, we're hoping to, in order to reduce the gap and increase our impact, we're hoping to look at in-person paper-based evaluation to take these questionnaires, go to community-based centers, go to homes, and translate this over in writing in order to our environmental dashboard, and then also our app as well. And then lastly, Rochelle spoke a little bit about the educational video campaign in terms of engaging healthcare workers and also public figures to increase education, understanding of breast cancer, and also breast cancer preventative measures. Secondly, we're hoping to engage with local healthcare providers such as Pro Mujer, which, for example, working with community centers for free mammograms, so that's something that could be better integrated with our platform. And then lastly, having a collaborative with governmental and local governments in terms of looking at infrastructures, looking at local government priorities, and also resource allocation as well.
Thank you, everyone, and just acknowledging all of the incredible people that contributed to our project.
Thank you.